Hello, my name is Joe Ebner and I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today's date is Tuesday, April 14th, 2020, and I welcome you to another COVID update for the greater Plymouth community in central New Hampshire. Many predictive models placed last week as the COVID peak for the United States. This is certainly good news. New Hampshire's predictions were about a week behind, and so we're approaching our anticipated peak in the next week. New Hampshire hospitals are in a good position with staff, beds, and equipment to care for the citizens of New Hampshire, and much of this is in thanks to you. Your social distancing and isolation efforts have certainly flattened the curve. Your prayers, your thoughts, your financial comforts have supported the healthcare workers in both the planning phases and in the southern part of the state, where they are much busier with COVID than we are. We've been through weeks of preparation for this, both in the healthcare system and you at home, and we are now in kind of a plateau or maintenance phase. But we cannot let our guard down just yet. The COVID prediction models have the disease present in our community until the beginning of May. And so for another couple of weeks at least, we need to continue with the social distancing, the stay at home, and all the other measures you're taking to keep all of us safe. It is uncertain what the end will look like from this period of time. We will certainly be looking countries to the east and west and around the country here to learn more about how to open up our commerce, open up our schools, and open up our workplaces in the weeks, maybe months to come. I know that this has caused some financial hardship for many of you. And so I want to draw your attention again to the website at the bottom of the screen, www.nheasy.nh.gov, for information there about how you can get needed financial assistance. And now for a COVID-19 update in New Hampshire. Currently, there are just over 1,000 confirmed patients with COVID-19. There have been, as of yesterday, 23 deaths statewide attributed to COVID-19, which is a 2% mortality rate. There are currently 152 patients hospitalized with COVID-19 across the state, which is a 15% hospitalization rate. And there are just over 2,200 patients being monitored for COVID in the state. Bringing those numbers a little closer to home, to the Plymouth community, currently we use a private lab testing through a private lab at MIT in Boston, which is giving us about a one-day turnaround time. So any suspected patients who are tested at Speare, we have those results within 24 hours. To date, we have had 4 positive tests, 63 negative tests, and currently there is one patient who has been hospitalized for about 2 weeks at Speare Hospital with confirmed COVID. He is doing well, and we anticipate a discharge within the week. Yesterday, we had 2 additional patients admitted for suspected COVID. We'll know those results later today and tomorrow. Speare Hospital is currently prepared for more patients needing hospitalization. As I mentioned in the weeks past, we have set up some things around Speare and around the community to help with dealing with the COVID pandemic. The first thing is that all of the practices in our community, both at Midstate Health Center and through Speare's practices, are practicing telehealth. This will allow you to access your physician, your PA, or your nurse practitioner using your cell phone or home computer and a downloaded free app to have an interaction with your provider, which is HIPAA compliant and secure. You can talk about what medical issues you're facing, what medication prescriptions you might need, or any other concerns you might have by calling your physician's offices. At the hospital itself, we have opened up the tent in the parking lot for rapid triaging of respiratory illness from other illness. We separate those experiencing respiratory illness from the others in the emergency room, and that separation continues through the floors upstairs and in the ICU. We have plans in the next week to expand our inpatient beds if needed from 25 beds to nearly 40. We are also expanding the capacity for critical care patients through adding ventilator and ventilation support. Our labor and delivery unit remains COVID-free for the protection of its newborns. Should we reach a surge capacity which overwhelms the 40 or so patients we can safely take care of at Speare, I mentioned last week that we have stood up a Plymouth Alternative Care Site, or a PACS. That PACS is currently located in the Plymouth State Ice Arena. It is ready to be opened for up to 10 patients, with an easy flex up to 40 additional patients, with an ultimate ability to take care of nearly 100 additional patients. I don't anticipate needing to open the PACS. Some may have wondered, with the recent flooding this week, what will happen if we cannot access the Plymouth State Ice Arena. If it is just the first floor that is flooded, but access to the building remains open, we can move our patients to the second floor of the ice arena to the PSU Welcome Center. In the event that access to that building is completely cut off by floodwaters, we are making a backup plan arrangements through Plymouth Regional High School. So what do we know? We know that most infections of COVID come from extended, sustained close contact to someone with symptoms or who is about to get symptoms in the next 48 hours. We also know that the majority of infections come from hand-to-face contact. So what can you do now to keep you and your loved ones safe? Wash hands all the time. It is okay to go out in public, but please be very conscious of washing your hands, either with a 20-second soap and water scrub or using a Purell-type antibacterial lotion. The second thing, avoid touching your face. These two things, washing your hands frequently and avoid touching your face, will reduce most of the transmission of COVID-19. Other things to do to keep yourself safe is to maintain that 6-foot social distance from others and to avoid crowded places. There's a question about masking. It's reasonable to mask and probably beneficial to mask for a couple of reasons. And I should also mention it's safe and okay to use a cloth mask if you're going out in public. For 2 reasons this is helpful. Number 1, if you are an asymptomatic carrier of COVID and you're coughing, that will keep your droplets contained and not spreading onto surfaces where you might be near. Secondly, it'll prevent you from touching your face, which is the other way to prevent COVID. I was happy to see last week when I went shopping that many people in our community are already wearing cloth masks going out into public. Please take advantage when you're walking into a grocery store to wipe down those cart handles with the supplied cleaning agent that will remove the COVID virus from the handle. So wash down the cart before you go into the grocery store. Keep that 6-foot distance. Get the groceries that you need for the week. On the way out, keep that distance again. Follow the guidelines set forth by the grocery store employees. And when you get to your car, disinfect first your hands, then take off your mask. As a reminder, the symptoms of COVID include most of the time fever and a dry cough with some shortness of breath, which is heaviness and a hard time breathing. These are the most common symptoms. Less commonly, you can have upper respiratory symptoms like nasal congestion or runny nose, sore throat, body aches, and gastrointestinal symptoms like diarrhea are also, and nausea are also rarely described. As a reminder, if you're having some of these mild symptoms, please stay at home but call your doctor. If you are feeling severely ill and feel you need to be seen, again, first call your doctor. They might be able to assess you through a telehealth visit or have you come in person. If you feel it is emergent because you're having a difficult time breathing, feeling short of breath, or a heaviness in your chest, please come to the emergency room. I will direct your attention to Speare's hotline at the bottom of the screen, 603-238-6464. This is manned 24/7 by a registered nurse who can answer any triage questions you might have about who to call or where to go. If you are planning on staying at home because you are feeling ill, plan to self-isolate for 7 days from the onset of symptoms and at least 3 days of recovery from your respiratory symptoms and fever. During that time, plan to isolate yourself in only 1 or 2 rooms. Try to limit yourself to 1 bathroom and clean the surfaces in and out of the bathrooms, the door handles, the surfaces, often throughout the day with a Clorox type wipe. All asymptomatic close contacts of that person suspected of COVID should stay home for 14 days from the last day of exposure. You can appreciate this is a long time for a family or a household to be holed up, which is why it's so important we try to decrease the spread of the disease by the social distancing I talked about earlier. As always, you can visit websites like Speare Memorial Hospital's website as well as Midstate's website for access to the CDC and the Department of Health and Human Services and other timely and accurate information. Many of you are asking, how can you help? You can see the Speare website for what we're currently in need of. We appreciate all of your prayers and thoughts for the healthcare workers. Currently, the only supply shortage we might come in the foreseeable future would be the cloth masks. So many of you I know are at home wondering about whether you should make cloth masks. Speare would like you to start making cloth masks, and you can email us at the number at the bottom of the screen. It's a COVID-19 donations at spearehospital.com. And we're accepting those masks now, and we appreciate any efforts you might be able to make. Down the road, as the volume picks up, we might be needing volunteers and additional donations. Our website is where you can find more information about that. Lastly, I'm asking you not to be afraid, but to be well.